All right, guys, our favorite time of the week again when we get to answer a few of your questions. Saagar, what is up first?
Okay, from Richard and Deco. First, this is the best $10 a month I think I've ever spent. Thank you, Richard. We very much appreciate that.
Thank you.
My question is, and it may be an obvious one, aside from politicizing a global pandemic, how much do you think America's overall health, nutrition, and poor health choices played a role in how hard that we were hit by COVID-19?
I think it was pretty significant.
Yeah, it was
for sure. You know, I mean, listen, if your immune system is already down because of whatever chronic condition or because of obesity seem to be a critical risk factor. And obviously we have, you know, an overweight population, and that's not to judge those. And anytime you have a societal problem, it's not so much about the individual as what's going on at the policy level and what's going on from a society-wide and cultural level. So I absolutely think that it was a significant factor. The next question actually ties into this, so I'll go ahead and read that one too, and we can discuss them together. Jennifer Miner says, Medicare for all and vaccines, public health. Do you think extending Medicare for every U.S. citizen would have helped to combat vaccine hesitancy and help rebuild trust in public health departments? If it can't be discussed now, then when? She also says, absolutely love the show. Thank you for that. This is one of the things that is really important here and ties into our health outcomes being the worst in the developed world. So many of our citizens are completely disconnected from the healthcare system at all.
Yeah, millions.
Like,
and even people with subpar insurance, so it's like tens of millions.
Absolutely. Right. Where, you know, or where your only experience has been completely predatory and exploitative. So since you don't have any direct connection to it, you don't have a person that you sort of innately trust and who's been there for you in previous times, of course that's going to fuel a disconnect from the system. It's going to fuel vaccine hesitancy. It's going to lead to worse outcomes in terms of just COVID. So I do think that these things all tie together. And I brought this up like a bunch of times, but I thought it was very revealing. We had that dude on from National Review.
Michael Brennan Dougherty, yeah.
Conservative, right? Like traditional, like Reagan type conservative thinker on economics, and who was like, look, these other countries that have national healthcare systems, that means all of their people are somehow connected to the healthcare system. And that may be a part, he was talking specifically about vaccine hesitancy, of why we've had higher rates of hesitancy here than other places around the world. Now, look, I think there's also just a cultural component. There's a deep vein of FU in American culture. I think a lot of people were sort of blackpilled by like 9/11 trutherism that have made them also very skeptical of the government and all of that. So I think there are other factors that play, but there's no doubt that our pre-existing conditions, the fact we have all these chronic conditions, the fact that we have a population that's uniquely disconnected from the healthcare system, I think all of those factors were at play in making both the initial outbreaks and then all of the vaccine uptake go inferior levels to the rest of the developed world.
I agree with all of that. And the main problem is exactly on the health and the nutrition is that none of it is designed for your benefit. A lot of it is designed for money. And look, like money is always going to be a part of it, but it probably shouldn't be the whole part whenever it's everything that you put into your body. And then the healthcare system is not designed to keep you healthy. It's designed to treat you if you're already sick. But that doesn't mean almost 9 out of 10 times they're not like, hey, you know, if you ate better food or did something, they're like, oh, well, here's a drug for your, you know, diabetes, or like, here's this expensive dialysis and heart disease alone are like 40% of all healthcare spending, 40%. So think about that. What are they both downstream? Obesity. And yet, we don't talk about that. And that's both cultural, but I also think it's a huge incentive within the healthcare system itself in order to not actually treat the foundations of a problem instead of just, you know, trying to, you know, treat the symptoms. Like that's not how it should be working.
The incentives in the healthcare system are to have people who are chronically sick.
Yeah.
And so that's how they make the most money. And so surprise, surprise, we have a lot of people who are chronically sick.
I can give you an example from my own life, which is that I have flat feet. So I went to the doctor. I was like, hey, my feet hurt. They're like, oh, here are these 5. And by the way, my deductible at the time was $7,000 for my healthcare, for my insurance. And they were like, oh, you need these $500 inserts to go into your shoes. And I was like, okay, well, what are you gonna do?
Yeah.
Right? And so then recently I got really into working out, and I was working with a personal trainer, and he's like, oh no, dude, he's like, we can get rid of those in like 6 months. And I was like, what do you mean? And he's like, oh, well, he's like, if we do a certain amount of feet exercises and more, we can actually raise your arch, you know, not necessarily necessarily you're going to be 100% cured, but you can actually reform the arch in your foot by, you know, working out with your shoes off, like doing squats in a certain way, going side to side. And I remember thinking, nobody ever told me this.
Right.
Nobody was like, oh, actually, with about 6 months of good work, and then after that you keep up a certain amount of exercises, you can relatively make it so that you can walk around in a normal shoe, which I haven't been able to do before this for 5 years.
Wow.
And I thought, this is crazy. This doctor who I went to go see didn't even present that as an option. And I obviously would have gone out to try to do it at the time. So that has been a very this one person.
There was no profit or commission to be made off of telling you some exercises.
I didn't have a lot of money at that time, and $500 was a real commitment. And, you know, that really sucked. I still wear the same inserts because I refuse to get new ones. And that was, you know, I just remember thinking like, wow, nobody even presented it as an option that you could treat the thing itself and you don't have to keep buying all these inserts for the rest of your life. So there you go.
That's
just
like
one experience.
Little microcosm. Multiply that by, you know, 1 million, and that's our entire healthcare system.
Okay.
All right, what do we have next, Saagar?
Third one from Drew Winkelmeyer, advice for young journalists. I'm a young journalist trying to find a way into the industry. I graduated about a year ago, right when the pandemic started, and I had a tough time navigating my way. Now listen, I sympathize. I wanted to ask some simple advice. I do understand things take time. One must work their way through the weeds and be patient. Nevertheless, I find myself not getting anywhere time and time again. Maybe you two have some sound advice that could spur some ideas for a young journalist to get started.
The path into journalism has never been more unclear, I would say.
It's a tough one right now.
It's very tough, partly because, you know, so many newsrooms are shutting down. And the traditional pipeline, you know, in yesteryear was you start your local outlet or your local paper and whatever, and you either stay there and do great work there or you work your way up. And that pathway just doesn't really exist anymore. So, you know, the thing I always say is you really have to sort of think of yourself in an entrepreneurial way. Social media sucks and we both hate Twitter, but that's where other elite journalists are. That's what they pay attention to. And so it's incredibly important to sort of build out your brand and your whatever it is that you want to get after, whether it's original reporting or commentary, to sort of build a footprint there. That's a good way. And then the other thing I would say, and this also like sucks, but it's just reality, is a lot of these positions, they get hired based on who you know. So
100%.
Any way that you can ingratiate yourself, even, you know, one thing, again, everybody's on Twitter. So if you can follow people on Twitter who are at a low level, not like the high level, but at the low level, and start to build some relationships, some rapport with them online, any sort of way that you can get physically in a room with people to start to ingratiate yourself to these networks, that is the most important thing that you can possibly do, because this stuff is not based on merit. Just look at the quality of the people and the work that's out there. It's so much based on relationships.
I just recently had to speak to a journalism class at Georgetown, and I told them the exact same thing. I was like, listen, it's all about who you know. I wish it wasn't that way, but it is. It doesn't have to be nefarious. It can be, you know, you have to go out there, make the right connections. And this is a cringe story, but back when I was like 19, Ezra Klein, who was the wonderkind of the time, came to speak to us. And I went up to him afterwards and I was like, hey, look, like, we disagree or whatever. And I was like, but how do I become somebody like you? And he's like, hey, give me your email. I was like, okay. So he emailed me actually a written up document. This is very kind of him. He didn't have to do this, which he clearly had been sending to a lot of people. And it was very good advice, actually. He's like, okay, you want to break into the industry? You have to go out and find a job where you're not necessarily at the most prestigious publication, but you're writing about exactly what you want to write about. Become a unique subject matter expert. And from there, people will recognize your talent and you can branch out. So that was great advice. I think that was back in like 2011 or whatever, 12, whenever he sent me that. But I think that it still holds today. I would tell you that, which is that if let's say you wanted to write about national politics, it used to be you should go work at the crime beat on the New York Times. Doesn't work that way anymore. It's maybe find a blog, outlet, YouTube, Twitter, TikTok, whatever. Find a niche, try to grow your audience. You can spiral it from there. People will recognize it, and then opportunities will come your way.
Yeah.
I know it's a vague answer, but just think about that mindset.
I think that's actually really good advice. Whatever it is you want to end up writing, you actually have to start off writing.
Writing
known
yes.
for that thing. Because, those sort of lateral moves from subject to subject doesn't exist
anymore. Okay.
Next question we got from Jill Bartline. Deep state. I am not entirely clear on what the deep state is all about. Can you discuss this, Saagar?
Oh, Jill, how much time do you have?
Great question.
Yeah, great question. The deep state, actually the best thing is to talk about the origins of the word. So where did the origins of this come from? It actually comes from the Arab governments, the Turkish government and the Egyptian government, in which we would recognize that presidents like Hosni Mubarak or whoever the military equivalent was in Turkey, this was in the 70s, kind of at the time, was that there was a bureaucracy within these governments that were deeply entrenched, deep as in that, unable to be removed, and which had significant sway upon policy. So that's the origin. Now think of it within our own system. We have, and put the politicization off, we have a deep entrenched career bureaucracy with a baked-in ideology, which is very much, influenced by money, power, their own exit opportunities, where they go to school before they get there, how Congress will or will not take a shine on whatever they're doing or not. That kind of coalesces into something which then they can move policy in the direction that they want. I mentioned in a recent show that I was reading Obama's book, and on the Afghanistan stuff, it is outrageous what they did to him as a brand new president. In the middle of his review for the Afghanistan war, the general who he had picked, Stanley McChrystal, to lead his campaign, before he even decided whether to send troops or not, publicly declared in a speech in London during the review process that there was only one way to do it. Then his own chairman of the Joint Chiefs of Staff testified before Congress and said the same thing. The only way we can do this is to put more troops in. And he called them into the Oval Office. He's like, who works for who here?
Yeah.
He goes, I'm the president. Like, you're supposed to take my orders. And they were like, yeah, sure. We like the system. And then they just kept doing it. And they kept it on themselves. That is a definition of the deep state.
Well, and then some of those same people were either on cable news or still in government.
Still here.
Under Trump and under Biden with the same ideology. And, we tracked this. The minute that Joe Biden said, I'm moving forward with Afghanistan withdrawal, we're going to push the timeline out a little bit, but I am really committed to moving forward. What did you see? You start to see all these leaks about the Afghan women and girls and the Taliban's going to take over. Oh, and now you got to worry about terrorist attacks. They threw everything they could at him. You saw the explosion of their outrage across cable news. That is the deep state. The best book I could recommend is Devil's Chessboard, which tracks the sort of founders of the American deep state, which is Alan Dulles and John Foster Dulles, for whom Dulles Airport is named.
Worst
Alan Dulles, head of the CIA, John Foster Dulles, Secretary of State. And they freelanced an entire foreign policy, the type that you could see happening, and also the underground type coups and plots and assassination, all of that stuff. And some of it the president knew what was going on. Some of it they were pressured into. Some of it the president Eisenhower didn't know what was going on. He's kept on under JFK. Mm-hmm. Some
Bay
would say
Pigs.
may have pushed him into Bay of Pigs. Some would say may have been involved in the untimely assassination of JFK. That's some speculation that is out there with some decent evidence behind it, by the way. Anyway, read Devil's Chessboard. And those types of, Alan Dulles is the most, sort of notorious character of the deep state. But these same sort of shenanigans of these people who, they outlast presidents.
Hoover was another good example.
So they think they think they really run the town. And in some ways, they do. So, a pet peeve of mine is because deep state got tossed around a lot in right-wing circles suddenly during Trump. This has been made into like some right-wing conspiracy. This has long been actually a left-wing, something that left-wingers have tried to—
structural critique.
Exactly, have tried to like instill in people and like why this is nefarious and why you've got to check the CIA and you got to check the military-industrial complex and the FBI. And then all of a sudden now you're like a crank if you talk about this stuff. But it's very real, and if you want to understand what's happening in Washington, it is actually important that you understand what's going on there.
100%. All right.
Last question. Giordano Bruno. What are the barriers preventing young people from running for office? The amount of politicians old enough to be the Pope that currently hold a position in public office is astounding. I personally think it's one of the main reasons for the current death spiral of the U.S. Since both of you have been living and breathing D.C. for a while now, what do you think is the reason for this? What's preventing younger folk from having a shot at getting a foot in the door? So Number one, I think just a lot of young people are like, screw that.
Yeah,
like,
screw this. I grew
life
up in
is
a
too
country of
short.
Iraq.
No,
9/11.
thank you.
Yeah.
But then the other piece is, and there's a bigger problem on the Democratic side where leadership has been stuck in place for a long time. And they're really discouraging of any new younger voices like reaching leadership. It's been totally ossified. So there are active barriers, the biggest one being, look, money is the lifeblood of politics. And if you're a young person just starting out relatively young in your career, you don't have personal wealth, you don't have family or intergenerational wealth, you haven't, achieved a level in your career where you're like around a bunch of rich people all the time, or you're just not, interested in being around a lot of rich people all the time, you're going to have a lot of trouble, I can tell you, as someone who tried to do this, fundraising and being able to raise what it takes for your campaign. Now, the hopeful thing is that very recently, I mean, this is really quite new, there's been established a new way of doing this with grassroots donors where, you don't have to be running for president. You can be someone who, is an AOC and inspires people and gets them to buy into your campaign from all across the country. That is now possible in a way that it wasn't before. It gives you a different power base and makes it more feasible for people who are young and passionate to ultimately be able to get in the game. But it is still difficult because not everybody is going to be able to catch that lightning in a bottle, is going to be able to capture the national attention and the national spotlight. And so that's what you're up against.
No, that's all absolutely true. And I would say another thing is the voters. Look, a lot of people who are old vote. The median voter in this country is 50 years old. And that is not what the median age is. I can guarantee you that. So look, a lot of people don't vote, and then that's reflected in their choices, their priorities, and more. And I know it's cliche, but that is a huge part of the problem that we have right now.
Absolutely. All right, guys, we love you so much. Enjoy your weekend. Hope you're having a great time. We'll see you back here on Monday. And again, programming note, Monday, Wednesday, Thursday this week rather than Monday, Tuesday, Thursday. So we'll see you Monday, and we'll see you Wednesday, and we'll see you Thursday. Enjoy your weekend.
See you then.